Doctor, I've been having these terrible headaches lately. What could be causing them?
Headaches can be a real pain, but did you know there are different types of headaches, each telling you something different about your body? It's true. Understanding what's at the root of your headache can make a world of difference when it comes to finding relief. That's why I'm excited to break down the mystery of headaches for you. In this video, we'll explore the most common types of headaches, dive into what triggers them, and most importantly, I'll share some natural remedies that can help you feel better, faster. So, if you're ready to say goodbye to headache misery and hello to a happier, healthier you, stick around.
Let's start with the most common type of headache, the tension headache. We've all been there, feeling that tight band or pressure around our head like someone is squeezing a vice. It's usually a mild to moderate pain that can last anywhere from 30 minutes to a whole week. Ugh, I know, not fun. Not.
So what causes this all too familiar pain? Well, tension headaches are often triggered by stress, muscle tension, or both. Think about it. You're working long hours at the computer, your posture is suffering, and bam, tension headache city. Other common culprits include dehydration, lack of sleep, and even skipping meals.
The good news is that tension headaches are usually nothing to worry about and can often be managed with simple lifestyle changes and natural remedies. One of the best things you can do is to practice relaxation techniques like deep breathing exercises, meditation, or yoga. These practices can help to calm your mind and ease muscle tension. Another important tip is to pay attention to your posture. Are you hunched over your desk all day? Try to sit up straight, relax your shoulders, and make sure your computer screen is at eye level. And of course, don't underestimate the power of a good old-fashioned head massage. Gently massage your temples, scalp, and neck muscles to relieve tension. Trust me, it can work wonders. Now let's talk about migraines. These are not your average headaches. Migraines are intense, throbbing headaches that can last for several hours or even days. They often come with other debilitating symptoms like nausea, vomiting, and sensitivity to light and sound.
While the exact cause of migraines is still a bit of a mystery, we do know that they involve changes in brain activity and blood vessels. Certain triggers can set off a migraine, including stress, hormonal changes, certain foods and drinks, like aged cheese, red wine, and processed foods, sensory overload, think bright lights, strong smells, and even changes in weather patterns.
Finding relief from a migraine often requires a multi-pronged approach. One of the most effective strategies is to identify and avoid your personal triggers. Keep a headache diary to track your symptoms, what you ate, your stress levels, and any other potential triggers. This can help you pinpoint what sets off your migraines so you can steer clear. Along with avoiding triggers, there are natural remedies that can help manage migraine symptoms. Some people find relief with cold compresses applied to the forehead or temples. Others benefit from relaxation techniques like deep breathing, meditation, or yoga. Dietary changes can also play a role in managing migraines. Staying hydrated is crucial, so make sure you're drinking plenty of water throughout the day. Eating regular meals and avoiding foods that are known migraine triggers can also make a big difference. Cluster headaches are the least common but most severe type of headache. These headaches are characterized by intense, sharp, burning pain that's often felt on one side of the head, usually around the eye. True to their name, cluster headaches occur in groups or cycles, with multiple headaches happening over a period of days, weeks, or even months. The exact cause of cluster headaches is unknown, but they're thought to be related to abnormalities in the hypothalamus, a part of the brain that controls sleep-wake cycles and other bodily functions. Some potential triggers include alcohol, smoking, high altitudes, and even certain medications. Due to their severity, managing cluster headaches often involves a combination of conventional medical treatments and lifestyle modifications. If you experience cluster headaches, it's crucial to consult with a healthcare professional to determine the best course of treatment for you. That being said, there are some natural remedies that may provide relief from cluster headaches. Oxygen therapy, which involves inhaling pure oxygen through a mask, has been found to be effective in some cases. Other natural approaches include avoiding triggers like alcohol and smoking, maintaining a regular sleep schedule, and managing stress through techniques like deep breathing and meditation. Chapter 4. Sinus headaches are often described as a deep, constant pain in the cheekbones, forehead, or bridge of the nose. They're usually accompanied by other sinus symptoms like congestion, runny nose, and facial tenderness, as you might have guessed. Sinus headaches are caused by inflammation or infection of the sinuses, the air-filled cavities in the skull. This inflammation can be triggered by allergies, the common cold, or a sinus infection.
Treating a sinus headache often involves addressing the underlying cause. If allergies are to blame, identifying and avoiding allergens is key. For colds or sinus infections, rest, fluids, and over-the-counter decongestants can help. But what about natural remedies? There are several things you can try to ease sinus pressure and pain.
Steam inhalation is a simple yet effective way to open up the nasal passages and loosen mucus. Simply fill a bowl with hot water, add a few drops of eucalyptus or peppermint oil, and lean over the bowl with a towel draped over your head. Inhale the steam for 10 to 15 minutes. Another important tip is to stay hydrated. Drinking plenty of fluids helps to thin the mucus and make it easier to drain. Warm water with lemon and honey can be especially soothing. Chapter 5. Hormonal headaches are exactly what they sound like. Headaches that are triggered by fluctuations in hormone levels. Women are more likely to experience hormonal headaches than men, thanks to the ever-changing levels of estrogen and progesterone throughout the menstrual cycle, pregnancy, and menopause. These headaches can strike at any point during the menstrual cycle, but are most common during the premenstrual period and during ovulation. Hormonal headaches can also be a side effect of hormonal contraceptives like birth control pills. Managing hormonal headaches often involves a combination of lifestyle changes and, in some cases, medical intervention. If your headaches are severe or interfere with your daily life, it's essential to consult with a healthcare professional to discuss treatment options. On the natural front, there are several things you can do to find relief from hormonal headaches. Maintaining a regular sleep schedule, eating a balanced diet, and engaging in regular exercise can help regulate hormone levels and reduce headache frequency. Certain supplements, like magnesium and vitamin B2, have also been found to be helpful in preventing migraines, which can be triggered by hormonal fluctuations. However, it's always best to talk to your doctor before starting any new supplements, especially if you're pregnant, breastfeeding, or have any underlying health conditions. Chapter 6. The dreaded hangover headache. We've all been there, or at least know someone who has. That pounding headache, nausea, and overall feeling of misery the morning after a night of drinking is a sure sign you overdid it. But what exactly causes hangover headaches? Well, alcohol is a diuretic, meaning it makes you urinate more frequently, which can lead to dehydration. Dehydration is a major headache trigger. Alcohol can also irritate blood vessels, contributing to headache pain. The best way to prevent a hangover headache is, of course, to drink in moderation or avoid alcohol altogether. But if you do find yourself with a pounding head after a night out, there are a few natural remedies that can help. First and foremost, rehydrate. Drink plenty of water, electrolyte drinks, or clear broth to replenish lost fluids. Eating a light, nutritious breakfast can also help to stabilize blood sugar levels and ease nausea. Rest is also key. Give your body a chance to recover from the alcohol onslaught by getting some sleep. And if you can stomach it, a cup of coffee or tea might help to constrict blood vessels and provide a temporary headache relief.
Understanding the type of headache you have can help you treat it more effectively. Remember, natural treatments can often provide relief without the need for medication. From managing stress to making simple lifestyle changes, there are many things you can do to prevent and alleviate headache pain.
Listen to your body, identify your triggers, and find what works best for you. Stay healthy and take care. Don't forget to subscribe for more interesting topics and tips.